Hello, and welcome to Frontiers in Health and Happiness, the official podcast of the Lee Kum-shung Center for Health and Happiness at the Harvard T.H. Chan School of Public Health. My name is Ayla Fudala, Center Communications Coordinator, and I'll be asking experts how to live a healthy, happy life. Did you know that loneliness can affect some people more than others? In the third installment of our Loneliness and Well-Being series, we'll be focusing on the intersection of loneliness and health equity. To explore this connection, I sat down with Dr. Koichiro Shiba, an assistant professor of epidemiology at Boston University and a Harvard Chan School alum. My first question for Dr. Shiba was, why is the loneliness issue so significant?
There's a lot of evidence suggesting that social disconnectedness, isolation, and loneliness impacts our mental health and psychological well-being. But also there's another line of evidence saying that disconnectedness can negatively impact our physical and cognitive health. So basically, disconnectedness can influence many aspects of our health and well-being. So that's one reason why we should care about social connectedness. Now, another reason why you should care about disconnectedness is that it can cause some societal impacts. For example, disconnectedness can deteriorate our society's economic outcomes. It can also lower neighborhood safety levels. A lower connection in a society could reduce disaster preparedness and resilience of a community, which in turn might influence many health and economic outcomes in the time of crisis. Social disconnectedness can introduce many negative adverse consequences that we want to avoid.
How does loneliness affect different people in different ways?
There are two things to consider. Social isolation itself is socially patterned, meaning that people from socially marginalized groups are more likely to experience social isolation. So there's a disparity in isolation itself, but also its impact on health is socially patterned. So I just mentioned that social isolation can influence our health, but its effect on health can be different across individuals, and people from socially marginalized backgrounds may be more likely to be damaged by the social isolation experience. So what that means is that if we don't address this problem of social isolation, people from marginalized background, first of all, they're more likely to be exposed to isolation, and also they're more likely to be damaged by isolation. Therefore, it might reinforce the existing disparities in many health outcomes.
Why do you think some people are more negatively impacted by social isolation than others? Do you have any theories on why this might be the case?
There are many possible reasons, but one of the reasons that I can think of now is that, for example, those people from socially marginalized backgrounds tend to lack resources that they need to cope with psychological distress that could arise from being socially disconnected and isolated.
So how can we address this inequity? Would promoting social connection also promote health equity? And if so, how?
So I think that promoting social connectedness can enhance health equity and address this issue of health disparities. And the reason is that, like I mentioned earlier, social isolation itself is socially patterned. People from marginalized backgrounds are more likely to experience isolation. Therefore, if we could do an intervention that removes social isolation from the population, those people tend to benefit more from the intervention. And also, like I mentioned earlier, social isolation affects health with the greater magnitude among people from socially marginalized backgrounds. And therefore, in this case, if we intervene in social isolation and remove that from the population, again, those people benefit more. So promoting social connectedness at the societal level has the potential to reduce existing health disparities in our society.
In your work, you advocate for a population level rather than individual level approach to promoting social connectedness. Can you explain what exactly that approach would entail?
When I say population approach to promote social connectedness, what I mean is to shift the entire distribution of social connectedness in a society instead of treating a limited number of people who are isolated. This kind of population level approach, there are many ways to do that. One example might be to build community-based places, right? So for example, in Japan, the Japanese government is encouraging local communities to open community-based gathering places where all adults can congregate. And we conducted empirical study looking at its impacts on people's health and well-being. And we found that opening the new community-based places and participating in those places can have positive impacts on our, first of all, social connectedness, but also our health and well-being outcomes.
Can you tell me about your work with causal inference?
To give you some backgrounds for those who are not familiar with this idea of causal inference. Causal inference is a sort of technique that epidemiologists tend to use to tease out causal effect from statistical association. Now, when we use causal inference, what we are really estimating is the contrast of two population averages of health. So comparing, it's really telling us how changing the level of an exposure might influence the average in population health. Now, this paradigm in causal inference, although it's very useful and it's being used to inform many decision makers, it's lacking an important perspective, which is that how the intervention might influence the distribution of health in the population, namely disparities in the health outcome. So I think there's a huge gap there, methodologically speaking, and we need a method to quantify the expected changes in health disparities that we would observe under a hypothetical intervention targeting an exposure of interest.
Your most recent research project simulated changes in income-based disparities in cognitive functioning among older adults under hypothetical population interventions addressing social isolation. The simulation asked the question, would population-level interventions to reduce social isolation also reduce disparities in cognitive function? What was the answer?
Based on what we found, the answer is likely yes. Reducing social isolation appears to be reducing disparities in cognitive functioning in the data we used, which is the sample of older adults in the US. But there's some nuance to it. So in this study, we simulated several interventional scenarios where we manipulated the distribution of social isolation in the population. Now, if this hypothetical intervention did not address the existing disparity in social isolation, right? So the intervention reduced social isolation overall in the population, but it maintained the social disparity in the exposure, which is isolation. That hypothetical intervention did not substantially reduce disparity in cognitive functioning. So it really depends on how you intervene in social isolation and how you reduce it in the population. And depending on how you do it, the implications of the intervention on health disparities might be different.
What were the associations between income, social isolation, and cognitive functioning?
In this data of, again, older adults in the US, we found that there was income-based disparity in the both exposure and the outcome, meaning that there was income-based disparity in social isolation. And the higher the income was, less likely to experience social isolation. We also found income-based disparity in cognitive functioning. Again, there we found that higher income was associated with higher cognitive functioning. So for both isolation and cognitive functioning, we found evidence of income-based disparity, at least in our study population.
Why do you think higher income meant lower social isolation and higher cognitive functioning? Do you have any ideas that could explain this correlation?
For social isolation, in order for you to be connected with others, you need time. And it's often the case that people earning a lot, they actually have spare time to spend to stay connected with their friends and families and children, and engage in social activities in the community, stuff like that. So in that regard, higher income people are more likely to maintain their connections with peers. With regard to the outcome, cognitive functioning, we don't know how that disparity was shaped. Maybe part of that was a causal relationship where people with higher cognitive functioning were able to make a lot of money. So that could be part of it. But also, if you were to maintain your cognitive functioning, you need a lot of resources. You need to engage in, intellectual activities. You may need some health promoting resources, and that's something you can afford with money. And that could explain the disparity in cognitive functioning that we observed in the data.
Do you think social connection is the solution to the loneliness epidemic?
If you mean social isolation or structural aspect of social connectedness, then yes, promoting structural aspect of social connectedness, for example, facilitating, social interactions between people, designing a place where people can congregate and make new friends, that can promote the structural aspect of social connectedness, which in turn might reduce loneliness. But at the same time, some people may feel lonely even if they are connected to people. So the changing the structural aspect alone is not going to be magically eliminate loneliness. And it's a very difficult task. Promoting connectedness at the community level or societal level can have another impact on loneliness, right? So it's not just about yourself being connected with someone, you feel less lonely. It's not just like that. If you live in a community where people are strongly connected, then that might also influence your level of loneliness. So promoting connectedness at the societal level might be another solution to tackle the problem of loneliness epidemic.
Finding solutions to the loneliness issue is crucial to public health. Could you share some of the most promising interventions to promote social connection that you've come across in your research?
I conducted several studies looking at the actions to promote social connectedness and its impacts on health. One very promising approach was to build a community-based places for older adults to mingle with their peers. Participating in those places and activities appear to be promoting social connectedness among participants and also promoting their health and well-being. So I think that is one very promising approach to promote social connectedness, and that is based on scientific evidence. One of the pathways linking social connectedness and our health is not just about the sense of loneliness and psychological distress. For example, connectedness can bring us a purpose in life, which can also influence our health and outcome. And in these community-based places in Japan for older adults, they sometimes interact with local kids. So there are some intergenerational interaction going on. And through the intergenerational interactions, some older adults gain a purpose in life, meaning in life, and that could influence their health outcomes.
How can we as individuals promote social connection in our day-to-day lives?
That really depends on the person, right? And people have different lives and different styles of communicating with people. It's important to have at least opportunities to be connected with others. And, so I think it's important to address any structural barriers for individuals to stay connected so that they can try to stay connected, right? Removing those barriers. So going back to this societal view, population perspective, at least ensuring that each individual has an opportunity to stay connected is an important thing that we should be doing as a society and as a public health community. And beyond that, individuals can do whatever they want to do. And, the approaches to stay connected, again, can vary across individuals.
What should policymakers be doing to promote social connection and address health disparities within the issue of loneliness?
Social connectedness is a health-promoting factor, and also it can influence many important societal outcomes. So whenever they plan policies and actions, they need to keep in mind that they need to think about how those actions and policy might influence people's connectedness and what's the implication of that. I think decision makers need to keep that in mind always.
This is my final question. What are your plans for future research?
So I think there are two lines of research. So the first line is that I want to keep working on the work I talked about today, which is that how promoting social connectedness might influence health disparities that we have in a society. So that's one thing. Another thing is to look at social connectedness as an outcome, because we know that it's an important outcome. We know that it matters. It matters because it affects our health and other types of well-being, but also staying connected and having quality relationship with peers itself is an end, right? It's something we want to pursue. So I want to work on research where we look at social connectedness as an outcome. What's the determinant of social connectedness? How is social connectedness distributed within the population, across the population? How is it changing over time? What's the inequality in social connectedness? How is it patterned? That line of research, I think, is very important, and that is something I want to work on.
Dr. Shiba's research reveals a crucial insight. The loneliness epidemic doesn't affect everyone equally. Those with fewer resources are more vulnerable to isolation and its harmful health effects. But there's hope. Population-level interventions to promote social connection could help everyone, but especially those in marginalized communities, thus reducing health disparities. Scholars, policymakers, and practitioners can work together to make these interventions a reality, fostering social connection and combating health inequity and loneliness across the world. This has been another episode of Frontiers in Health and Happiness, the official podcast of the Lee Kum-sheung Center for Health and Happiness at the Harvard T.H. Chan School of Public Health. To learn about upcoming events, visit our website, sign up for our mailing list, and follow us on LinkedIn, X, Instagram, YouTube, and Facebook. In the next installment of our Loneliness and Well-Being series, I'll be speaking with Dr. Jeffrey Hall, an expert in the intersection of social media and loneliness. Dr. Hall is a professor of communication studies at the University of Kansas. He served as the 2023-24 Rebooting Social Media Visiting Scholar at the Berkman Klein Center for Internet and Society at the Harvard Law School. New episodes in our Loneliness and Well-Being series will air every 2 weeks. Episodes can be found on the Lee Kum-sheung Center for Health and Happiness website and YouTube channel, as well as on Spotify, Apple Podcasts, and wherever else podcasts are found. Thank you for listening.